Well, now it is time for our regular health checkup.
Today we are talking about antibiotic allergies because lots of Australians carry an allergic to antibiotics label in their medical record, and that can change which drugs they're given when they're sick. But many of these labels are old, vague or simply wrong, which can mean people miss out on the best treatment and contribute to antibiotic resistance. And joining us now to unpack this all is paediatrician and infectious diseases expert Dr. Linny Fong.
Hello,
Good morning, Linny.
Hi.
How common is this?
Yeah, so in Australia, in terms of hospital inpatients, 1 in 4 patients carry an antibiotic allergy label. So it's quite significant. And I think that the issue with this is that unfortunately not all of these labels are true labels. So a lot of people think about true allergies versus not like false allergies. So often people think that when they have gastrointestinal upset or nausea that that's an allergy, that's an intolerance.
Interesting.
Whereas a true allergy is actually an immune reaction. So if you have a rash, so hives or swelling or severe cases anaphylaxis or trouble breathing, that's an allergy. And so really it's important for people to be able to distinguish between a true allergy and an intolerance.
And obviously this is pretty important, isn't it, when you're getting treatment for various illnesses or viruses?
Yeah, that's right. So unfortunately what happens is, as clinicians, if someone is sick, we obviously need to reach for the first-line antibiotic. And if that first-line antibiotic, which is often penicillin-based, is not available, it means that people get alternative treatments. And unfortunately that means it can be associated with more side effects sometimes. They can be more expensive, but also they can unfortunately lead to complications as well. So there is greater risk of people with antibiotic allergies getting longer hospital stays and also those complications. And, there's also the risk of increased antimicrobial resistance because we're using broader antibiotics rather than those targeted ones.
We were just talking about this before, and I'm allergic to penicillin. My face blew up, so they said, do not have that again. My hands blew up as well. But why are these so most commonly misdiagnosed as an allergy?
Yeah, so it's really important. A lot of people are diagnosed when they're children or labelled when they're children, and often it's because children often have viral rashes, and then during a viral rash they might be mistaken to have an antibiotic allergy, and that label unfortunately sticks with them for life. And then it's hard to kind of get rid of that label unless someone is actively going out and getting tested against these, these allergies. And so one thing that's been sort of discovered and talked about recently is that you can actually have a penicillin allergy and lose that allergy. So your immune system becomes tolerant. So we've found that a large number of people who previously were penicillin allergic are actually not anymore. So definitely worth being investigated further.
How can we work that out? So there's a test now.
Yes, yeah. So what we do in practice is, firstly, we highly encourage that people go and get tested if they have an antibiotic label and then that they're not sure about. So with a careful history and risk assessment, low risk people can have what's called an oral challenge, which is a small dose of an antibiotic just to test whether or not they are truly allergic. And then those who are at higher risk can have a medically supervised either a blood test or a skin prick test to determine their allergy status as well. But I think obviously it needs to happen in supervised hospital settings, and it's obviously not something that's done at home, but it is so important because when you are, hopefully never, but if you were sick and presented to hospital, it's good to know what antibiotics are available to be able to treat, the patient in front of us.
And of course, this is so important in terms of antibiotic resistance. That is a huge issue, isn't it, facing the medical profession?
Exactly, and that's one of the sort of biggest threats to, I guess, society. The WHO have talked about antimicrobial resistance being, something that's coming, and if we are using the wrong antibiotic and we're not targeting things as well as we should be in terms of bacteria, then we are contributing to that problem as well.
Can I ask about allergic reactions? How does that even start? Is it something it happens straight away or that develops over time?
Yeah, it's a really good question. So often with the immune system, allergic reactions are about sensitising the immune system. So often the body will recognise something as foreign and then it will pick up on it, and the next time you're exposed, it will develop a reaction to it if it doesn't, it's almost like it doesn't like it. So when it comes to antibiotics, often the first time you have it, you might not have that reaction, but over a couple of days you might develop a reaction. And that's, they are true reactions, and that's what we are looking out for. But those patients who don't have a reaction, we want to be able to say on their drug chart that they are okay to have that antibiotic. I think one of the other interesting things recently is there's been studies coming out of the Austin Health and Doherty Institute to talk about penicillin allergies, and what they found is that a lot of patients who are labelled as penicillin allergic, up to 95% of them, when they were carefully selected and found to be low risk, were found not to be penicillin allergic at all.
Wow.
So that's a huge...
That's massive.
That's huge, because penicillin allergies are the most common allergy in Australia. About 2 million people have reported penicillin allergy.
Wow.
And so if we are able to carefully select the right people and take that label off them, then that is a huge amount of, potential saving for the healthcare system, and, right antibiotics, antimicrobial distributor, all those things. Yeah. So really important.
So interesting. Linny, thank you. We appreciate it.
Thank you. Thanks for having me.